SMART is really focused on the whole child.
Whether it's mental, whether it's physical, or whether it's socioeconomics.
It's not just a doctor's office in the school, it's so much more than that.
It is fundamentally an investment in school success.
SMART is a school health solution that's dedicated to academic achievement. It's a business model. SMART really lives at the intersection of health, education, and workforce. SMART is really about identifying what are the barriers to academic success, eliminating them if possible, mitigating them if not, and then creating the environment that's conducive to learning.
Your patient is the school, so it's keeping the teachers healthy, keeping the staff members healthy, keeping the children healthy, and then knowing that them being here is a sign of health. If you're comparing SMART school clinic to a primary care clinic, the primary care clinic, I'm waiting on the patient to tell me that they need to be seen. SMART with the active access, active care model takes that to a whole nother level.
Active Access is my job to connect with you, not your job to find me. Active Care is now we have a relationship and you're going to be much more likely to come to me, and we're now working together with a plan of care.
What we fail sometimes to realize is that there's a physical component to academic performance that can affect the way they learn, how they come to school, and what they take away from school.
If kids have to struggle with health concerns or with psychological concerns, all of those things undermine the prospects for good learning.
We're starting young with our babies to let them know that behavior health is important, wellness is important, eating healthy is important.
When we say that SMART is an antecedent component to primary care, we mean that these students will grow up and be active participants of their care. Talk to their doctors, follow up with appointments, be compliant with the medications, realize the importance of exercise and nutrition, and prevention of chronic health conditions.
The SMART model really is designed to try to get at as many kids as possible, and it has a business model underscoring its initiatives that allows it to do that very effectively.
The model is the same at each site, but in fact, the approach to leveraging the resources within the community and from the company partners are always being refined.
That's why we not only have the same outcomes, but actually accelerated outcomes where we were able to move faster, reach more students at a lower price point.
One of the things that we'd love to see is any school that needs a SMART model will be able to have it. If you talk about breaking the cycle of poverty, we know that you need to have education as a component of that. To have the chance to get in at the school level and then positively inspiring them to finish high school, to go to college and to move on is so powerful.
School climate and culture is a big part of the success of a school. And when you bring a clinic in that everybody has access to, there's not a stigma attached to it because everybody goes.
Many learners have varying needs and struggle often in silence and often invisible, in fact, to the teachers and the principals and even to the healthcare providers in those schools. SMART is able to address those unknown needs that so many young people are reluctant to bring forward. The impact, not just on the whole child, but on the whole school community is profound.
There's very clear evidence already that the attendance has gone up and the tardiness has gone down. Kids who actually go to school, listen to their teacher, do their homework, do well in school. The SMART Health Clinic is an investment in all those things.
Since the SMART Clinic has been at Reform Elementary School, we have had a decrease in absenteeism. Out of the 98% of the students who are consented, 100% of them have been seen.
Over time, that in turn translates into better grades, better test scores, and ultimately higher graduation levels.
Addressing the needs of the whole child, the whole learner, has profound implications for the whole entire school and, in fact, the whole entire community.
Aramark didn't see where there was anybody doing what the SMART model was doing, especially with the immediacy of the results and the impact and the commitment of all of the partners to just keep building it out.
I wanted something that was going to make a difference.
The kind of public-private partnerships that have been created through multinational companies like CVS and Aramark to school systems that have come together behind a model like SMART is a real testament to the impact that SMART has had.
We've had a lot of people come in and say, okay, we're going to do this for your students. We're going to do this initiative. We're going to do that. 2 or 3 weeks, and then it just kind of fizzles out. And that has been the difference between the SMART model and those other programs.
It's not just a cookie cutter, here's our program, just do what we say. It's how does this work in your community? How does this work with your patient population? They help you adapt it to where it's appropriate, but yet maintain the fidelity of the model.
We need transformative leaders that are willing to come alongside us and take a fresh look at how SMART solves problems and what are the policies and the culture and the environment that will create fertile ground for SMART.
We had lots of meetings with the GIN Consulting Group. From day one, everyone had a partnership and had ownership and had a voice in what was going to take place.
It can't just be implementing a SMART Clinic site and that is the end. This is why the ethos system that GIN Consulting has developed to gather data on a daily basis and over the long term is so critical to ensuring that we are in fact accountable to the goals and the philosophy of the SMART model.
They gave us what we needed to become confident in our roles, and now I look at the clinic and I see the team and how everyone's confident and how it's something just beautiful.
We're not trying to say that any of this is easy, but what we're trying to say is that it's worth it. It's worth it because it works so quickly and you can see the rewards of your labor so immediately in the lives of these children.
I want them to know you may go home to something that's rough and it might not be a happy place at home, but you have a happy place at school and you have a happy place in the clinic.
And the SMART Clinic is sometimes the only bright spot that a lot of our babies see, and this is their safe haven for 8 hours a day. That is what has made it all worthwhile to me.
To learn more, contact GIN Group Consulting at smartstudenthealth.com.